Afternoon. Welcome to today's Wisconsin Health News virtual newsmaker with Dr. Jesse Ehrenfeld, President of the American Medical Association, Director of the Medical College of Wisconsin, Advancing Healthier Wisconsin Endowment, and numerous other titles. We're thrilled that Dr. Ehrenfeld could share some of his time with us today. My name is Tim Stum. I am the editor of Wisconsin Health News. Thank you all for tuning in. Before we get started, I want to make sure we thank our generous sponsors of the Wisconsin Health News virtual series. These important discussions would not be possible without their support. So a huge thank you to Aurora Healthcare, AARP Wisconsin, Anthem Blue Cross and Blue Shield of Wisconsin, Gundersen Health System, Husch Blackwell, and Quartz. Wisconsin Health News is an online, nonpartisan news service. In addition to hosting events like this, we also publish a daily email newsletter. If you're not yet a subscriber, I encourage you to sign up for a free trial, which you can do on our website at wisconsinhealthnews.com. And I want to give an extra thanks today to Husch Blackwell, today's featured sponsor. We are really grateful for all of their very generous and continued support. Here to say a few words is Bruce Arnold.
Good afternoon, everyone. Tim, thanks a lot for the shout out. We've been a supporter, an original supporter of the Wisconsin Health News, and will continue to do so. This is, I think, the leading way for folks to find out what's going on in real time in the state of Wisconsin. So Tim, a reverse shout out to you and your team and to Sean for the good work you do. As folks on this seminar know, Husch Blackwell is an AmLaw 100 firm. We're pretty lucky to have been recognized for the first time, I think, ever as the top first firm to hold simultaneously the top ranking in both the American Bar Association's Health Law section and the American Health Law Association, an honor we received in May. But the thing I'm proudest about, and this fits beautifully with the presentation we're going to hear today, is the way Husch has leaned into mental health. We had our first in-person retreat of our 1,000-lawyer law firm in Chicago this past weekend. And our featured speaker was Laura Maher, M-A-H-R, who I'd highly recommend to folks. She's the author of A Resilient Mindset, an intelligent approach to the science of stress. And the legal profession is just as susceptible to stress as the medical and other professions are. So that's what I want to say, not so much about Husch, but about how important I think it is, Tim, that the Wisconsin Health News has our presenter here today. And gosh almighty, how lucky we are that the president of the American Medical Association is just a couple 5 hours down the street from our Milwaukee office. So thank you, Doctor. Really looking forward to your presentation.
Well, thank you. Thanks so much, Bruce. Thanks again to you and Husch Blackwell for all of the continued and generous supports and always really generous remarks. We always really appreciate it. Some great words to get us started on. I have a slew of questions for Dr. Ehrenfeld, so I'm going to dive right into them. Dr. Ehrenfeld, again, thank you for being here today. Thank you for sharing some of your time. In addition, as I mentioned, to being the president of the American Medical Association and a tenured professor of anesthesiology at the Medical College of Wisconsin and a consultant to the World Health Organization's digital advisory group and a father of two. And I don't know how you do this all, but you're also the director for the Medical College of Wisconsin's Advancing a Healthier Wisconsin Endowment, which I think is maybe not quite as well known as it should be. And I thought we could start by having you just briefly tell us more about the endowment and some of the impact that it's had on healthcare in Wisconsin.
Sure. Well, Tim, thanks for having me and having this conversation today. The Advancing a Healthier Wisconsin Endowment, or AHW, is Wisconsin's largest health improvement philanthropy. And it's the only health philanthropy in the nation stewarding public funds within a private medical school, which is the Medical College of Wisconsin. It was established by MCW because of a generous financial gift made by Blue Cross Blue Shield United of Wisconsin to the people of Wisconsin. And we have the extraordinary stewardship responsibility to invest in promising research, support community health, and build the health workforce. And since 2004, AHW has given away $338 million to projects all over the state. We've funded work directly in 64 of Wisconsin's 72 counties, and we've got a lot of work ahead of us.
Excellent. So the endowment is about to, as you noted, about to reach 20 years of providing grants for community health improvement, research, workforce education. Are there any changes in store? I mean, what are some of the areas that you plan on focusing on going forward?
Well, we've got really three overarching goals for all of our work: trying to achieve and inspire positive, sustainable change, trying to translate new knowledge into results-oriented action, and increase the strength, agility, and performance of our partners. To do that, we work in three areas: public and community health improvement, health workforce development, and health-focused research.
Excellent. So I know that a focus of a lot of the grants of the endowment has been on health equity. Wisconsin faces some of the worst health disparities in the country. Why is that? I mean, why is our state worse than a lot of others? And what more can be done? I mean, I know this is a big list and worthy of its own, very long, detailed discussion. But what are some of the steps that can be taken to help close this gap in outcomes here in Wisconsin?
Yeah, so underpinning all of the work that we do is a deep commitment to advancing health equity across the state, meaning that everybody has the opportunity to achieve their highest level of health. That's the CDC definition. For us, that means maximizing the health of everybody in Wisconsin: urban centers, rural and agricultural communities, our self-governed tribal nations. And these differences in health, how long people live, their physical and mental health and well-being, between populations are really connected to stress caused by unequal access to wealth, unequal access to good paying jobs, unequal access to stable income, food, transportation, housing. And those are things that are driven by policy decisions. And these social determinants of health are influenced by the ways that power and rights and opportunities were historically enacted and continue to be enacted today. And those policies and practices have a profound impact on health. And so the health inequities that we see all across the state are a product of decades of policies and practices that have caused harm and have facilitated disinvestment, particularly in communities of color and to people with less access to social and economic resources and power. It's why we have pregnancy-related death rates for African Black moms 5 times higher compared to white moms. Infant mortality rates for babies, Black moms, is 2.7 times compared to white babies. I've got a 9-month-old. And when I was in the hospital, my husband and I knew that our baby, simply because of the color of our skin, had a different chance of coming into this world. And these are not problems driven by genetics or biology. They're problems driven by structural changes. And so the easiest thing we could do in Wisconsin to advance health and reduce those health inequities would be to expand Medicaid and lower the rates of people who are uninsured, who don't have access to medical care. We're one of the last states that hasn't done this. There are only 11 left. We also need to expand and diversify our healthcare workforce, which is a focus of my work at MCW.
Excellent. Well, thank you, Dr. Ehrenfeld. So I want to shift gears a little bit. In June, you became president of the American Medical Association, serving a 1-year term. And I know the AMA has a pretty well-defined set of priorities, and it is your job to promote them and push them. But while you have this personal spotlight for the next year as really kind of the face of the American Medical Association, is there a specific issue or two that you're most interested in, or most excited about focusing on during the next year?
Well, it's humbling. It's humbling to be in this national leadership position, to be the first anesthesiologist, one of the youngest AMA presidents, and the first person from Wisconsin in 64 years. The last person who was an AMA president from Wisconsin was Dr. Gundersen in 1959. But my job really as AMA president this year is really squarely focused on the big challenges in our healthcare system. And for much of the year, that's focusing on what we call our recovery plan for America's physicians, reforming Medicare payments to make sure that we have thriving practices and innovation, trying to tackle prior authorization to reduce the burdens on practices, to reduce delays in care, making sure that patients have access to physician-led care to ensure patient safety, trying to reduce levels of burnout in our healthcare teams, workforce, trying to reduce the stigma around getting care for mental health, and trying to advance digital health and telehealth to make sure that patients can benefit from those services.
Excellent. Thank you. So I want to talk about several of those. Physician burnout is something that I know you've talked a lot about already. Just how serious of an issue is this, both in both nationally, but also here in Wisconsin?
So the pandemic magnified some long-standing issues that have accelerated the U.S. physician burnout rate. At the end of 2021, nearly 63% of physicians reported symptoms of burnout. That was up from 38% in 2020. AMA Mayo Clinic conducted a survey during the pandemic. We found that nearly 2 in 5 nurses, 1 in 5 physicians said that they were likely to give up practice, leave the profession within 2 years. And another third said that they were going to reduce their work hours. Now, we've already got a physician shortage. And so if even a portion of that data pans out into real resignations and people leaving practice, you can think about the impact on healthcare access across the state and across the country. Now, we are making some good progress. Following AMA advocacy, President Biden signed into law the Dr. Lorna Breen Healthcare Provider Protection Act. It's named for Dr. Lorna Breen, who died by suicide in April of 2020, following a very intense stretch of treating COVID patients at the onset of the pandemic. That bill is designed to bolster mental health for physicians and other health professionals by creating some grants to reduce burnout, trying to have this national campaign so that we can promote accessing mental health services. And we've had a lot of policy victories in states to try to reduce the regulatory burden, reduce documentation burden, and we continue to champion relief funding and policies that enable us to restore the joy in the practice of medicine and get back to our jobs, which is taking care of patients, not filling out forms.
Mm-hmm. Are there certain specialties that are impacted more than others? And kind of question two, what impact has COVID had in exasperating, increasing this?
You know, the specialty data is a little bit mixed. We certainly know that the universal trend is that it's worse across all specialties. And certainly, I do think that there are opportunities, particularly for technology, to play an important role in addressing some of these burdens, addressing some of these workforce shortages. But we've got to make sure that we have technology that is designed for our healthcare team members and physicians, understands the workflows, and becomes an asset, not a burden. And unfortunately, we have lived through a very difficult, challenging rollout of electronic health records incentivized by federal dollars that was really hard because that technology was not designed with the physician in mind, was really designed to incentivize, billing systems and created all sorts of challenges and headaches. And so we don't want that mistake to be repeated. There's a lot of excitement about AI and other digital technologies, but we need to make sure that these things actually work for patients if we're going to address burnout and physician shortages.
Great. Some say that a solution to burnout and addressing this workforce shortage is to allow more providers to work to the full scope of their practice. This is an issue here in Wisconsin where advanced nurse practitioners are asking for more authority, and certainly nationwide. I mean, last month you testified before Congress on the VA's plan to implement new scope of practice standards for a variety of providers. The AMA is a strong advocate for a physician-led team practice. Can you expound on that more? As you mentioned, as we've talked about, physicians are burnt out. There's not enough of them. In this workforce crisis, why doesn't it make more sense to allow more providers to work to the top of their license, especially in underserved areas where there aren't enough physicians?
It's a great question. So nurse practitioners, physician assistants are invaluable members of the team, but they're just not a replacement for physicians. We know from study after study that data are clear. We went over this at a congressional oversight hearing last month. When you remove physicians entirely from the care team, you see higher costs and lower quality of care. So the AMA strongly supports physician-led team-based care. Every member of the team has unique knowledge, has valuable contributions. And I work day in and day out with nurse anesthetists and anesthesia assistants, and I value those relationships and those partnerships tremendously. But everybody benefits when we come together in a collaborative way to improve the overall health of our patients, not creating more silos. So we believe that some of the shortages that we're seeing, and if you look at the Association of American Medical Colleges data, it's a wide range. They say, somewhere between 40 and 120,000 physicians will be short in a decade. It's a big range, but the number is big regardless of which end you're on. We need to make sure that we expand graduate medical education training slots, and we have supported legislation through the AMA for a long time to do that. Congress did make a small investment to shore up the physician workforce. They added 1,000 new Medicare-supported GME positions in the Appropriations Act in 2021. First time that had happened in 25 years. And the Appropriations Act of 2023 has another 200 spots specific to psychiatry and psychiatric subspecialties. But there are other obvious things that we can do. You know, we know that there are opportunities to think about how we get people into underserved rural physician shortage areas. There's the Conrad State 30 bill, Physician Access Reauthorization Act, which would allow international doctors who train in the US to stay in the country if they practice in an area experiencing medical shortages, and we have a bunch of those in Wisconsin. It makes no sense in my mind that we bring international doctors here to the US, we train them, they go through residency, and then we require them to leave for 2 years before they can come in and practice, when we've got lots of areas, particularly around Wisconsin, where there are these medical shortages and we can put them to work right out of the gate.
Great. Can you talk more about the impact that technology and specifically AI can have on addressing some of these workforce shortage issues?
Well, I'm really enthusiastic. I'm board certified in anesthesiology and clinical informatics, so I've been a technology developer for nearly 2 decades, doing decision support and AI development work a lot longer than it's been cool. When I think about AI, and the AMA is very intentional, that we describe AI as being augmenting intelligence, not artificial intelligence, because really the idea is that we should be able to boost the capacity and the capabilities of our teams, not replace them. And I don't think AI is ever going to replace doctors or nurses, but I do think that doctors and nurses who use AI will replace those who don't. And there's some exciting things that are out there. The first autonomous AI approved medical device, it's in the diabetic retinopathy space. And you may know that every patient who has diabetes ought to get an eye exam every year to check for diabetic retinopathy, because if you catch diabetic retinopathy and you treat it, you can prevent blindness. And that's obviously a devastating complication of diabetes. We do not have enough people to do diabetic eye exams every year. And so there are thousands and thousands and thousands of people in Wisconsin and across the country who don't get these exams. Well, there is a little set-top box. You can put it in a corner pharmacy, you can put it in a primary care office, you can put it in a hospital, you can put a patient in front of it with really no training and get such good pictures of the eye, and the image recognition in the eye is so good that the company carries malpractice insurance on the device. Now, what does that do? That scales the capacity to do those exams, and it totally changes the work that our ophthalmologists are doing. Now our ophthalmologists don't have to do hundreds and hundreds of normal screening exams to find the patients with the disease. They can just see the patient with the disease. So we're seeing really exciting clinical use cases for AI coming into practice. And about 20% of practices across the country, based on AMA survey data, are using AI today.
Well, what are some of the main challenges or maybe concerns when it comes to AI in healthcare? As this technology rapidly advances and is used more and more, what are things we need to be careful about at this stage?
Well, the regulatory framework is very uncertain, and the FDA has signaled that they are likely to come forward with a new approach to regulating software as a medical device and AI-enabled products. We don't know what that's going to look like. I agree that a system set up in the 60s and 70s just is not well suited to handle software in these algorithms and things like that. But it's really important that we only have safe and effective products in the marketplace. And it's not clear to me, it's not clear to the AMA that the FDA framework is going to go far enough. They have signaled that they are likely to allow developers and companies to bring products in the marketplace without doing individual level product approval, but rather a good manufacturing product checklist kind of approach, which means that we're going to have to rely on after the fact post-market surveillance evaluations to see if there are problems. And we've already seen glorious failures of algorithms developed at leading centers, put into production at scale, that have failed, that have made biases worse, that have harmed patients. And I do worry that if we don't get the regulatory framework right, if we don't have an understanding of where these algorithms are being implemented into practice, we could cause some real challenges.
And do you think that the regulators are, the federal government's never been known for moving fast? Do you think that the regulations are going to be able to keep up as this technology continues to advance at the pace that it has? And if not, what happens in the meantime?
Well, we don't want to stifle innovation. That's for
Mhm.
sure. But we also need to make sure that we have safe products coming into the marketplace. And there's going to be a whole class of products that are not subject to FDA regulation. So, there's a large technology company that you use to search on the internet probably every day that has an image assist product for skin lesions. It's available in the EU, not here in the US. You can find it on the internet. Take a picture of your skin and it suggests a condition. Well, that will likely not have an FDA label on it. So, consumer is going to have to understand, well, they're going to have assumptions about, how that was approved and regulated. And I worry, what happens when something goes wrong? What happens when the algorithm changes on Friday, but you used it on Monday? Who do you call when you have an issue like that? And doctors, we're going to be stuck in the middle, right? Because our patients are going to use these things. They're going to be a flood of consumer-facing products out there. I work very closely with the Consumer Technology Association to try to understand what this is likely to look like. We want to make sure that we have a marketplace that's successful and we minimize any risk to patients.
What role are doctors playing, or what role should doctors play in these discussions about regulations?
Well, less so on the regulatory side, but more on the development side. We want to make sure that the voice of clinicians is at the forefront. Again, we have seen product after product brought into the marketplace that was really disconnected from the clinical reality of how we take care of patients. And that happens when you don't have a physician, you don't have a nurse at the center of the development and the design and the implementation cycle. And so the AMA has worked really hard to create an ecosystem around this. We have something called our Physician Innovation Network. It is open to everybody. It is open to physicians, trainees, nurses, all allied health professions, companies to come together to ask questions about a product that people are working on, to collaborate. And we've seen some really exciting results from that. It's helped companies bring more effective products to market more quickly. And again, it brings that clinical voice forward in a way that we just haven't seen at scale.
So this is all really exciting to learn about and to talk about and think about the potential this can have. But is this something that patients want? I mean, what's being done or what more needs to be done to earn patients' trust when it comes to AI and the impact that it could really have on how healthcare is delivered?
Trust is a real issue, and there's clear data that consumers are wary. Consumers are worried about having an AI algorithm making a diagnostic decision. We need to earn that trust, right? It's not a given. And there's data out there that suggests if patients are given a choice, the computer or the doctor, they choose the doctor every time, even if you tell them that the computer is going to be right more often than the doctor, because they trust the doctor. They trust that the doctor can take into consideration their unique circumstances, their social situation, their family, what's going on, what's important to them, which is true. And that's why we think it shouldn't be technology versus, the person. It should be them together. But we need to be clear about where we're using these technologies, how we're using them, if we're going to earn and retain the trust of consumers.
So another, just shifting gears a little bit, another top priority, which you've mentioned for the AMA is prior authorization reform. Can you just talk a little bit more about that? I mean, what are your kind of main concerns with where things are right now when it comes to prior authorization?
So prior authorization has led to just a host of unnecessary Byzantine barriers to the care for patients. And we do a lot of survey work on this. More than 4 in 5 physicians, 86% tell us that prior authorization leads to unnecessary waste rather than cost savings. 2/3 of physicians across the US tell us that it leads to a reduction in their ability to take care of patients. 46% of physicians tell us that it leads to urgent or emergency care for patients because routine stuff was denied and that people have to go to the emergency department. And so we know that this is something that really is frustrating. You're a physician, you're expertly trained, you're up to date on the latest treatment, you've met your patient, you've examined them. Together with your patient, you come up with a treatment plan. But before the patient can get the treatment, you got to convince somebody. Faxes, phone calls, people who are not often an expert in your field certainly have not examined your patient to authorize the care. And I will tell you, I'm an anesthesiologist. I have the privilege of seeing patients every other week. And I usually ask my patients, how long did it take you to get your surgery scheduled? And, it's usually, a couple weeks or a month or something. And then I say, and how long did it take your insurance company to approve the surgery? And it's usually 3 times as long. And unfortunately, prior authorization is just a process that has not worked effectively for patients or physicians, and too often, patients just abandon giving the care that they want. And for me, I see my colleagues who overwhelmingly joined the profession to help people get tied up in this time-consuming, frustrating, broken process. And that's why fixing prior authorization is a key goal of our recovery plan for America's physicians.
So we hosted a panel of insurance CEOs earlier this month in Milwaukee, and this topic was brought up, and this panel of insurance CEOs told us that prior authorization is a really important tool. It's one of the few that they have to help lower healthcare costs and help get patients quality care. How do you respond to that?
It is overused, and the data are clear, and we're starting to see major third-party payers peeling back massive swaths of prior authorization requirements because patients have had it. Lawmakers have it. We've seen CMS promulgate rules in the Medicare Advantage plans, which are some of the worst offenders, to make these things no longer possible. So I think, if you ask a patient, if you ask a friend, almost everyone has had a bad experience trying to get something simple, obvious, approved that unfortunately is just in the hands of the insurance companies at this point.
So the AMA has been increasingly vocal on public health issues like gun rights and climate change. Why are these issues that the AMA should weigh in on it? How do these impact the country's doctors?
Well, the AMA's advocacy on big public health issues really comes down to our mission, which is to promote the art and science of medicine and the betterment of public health. In fact, all of our work really focuses on 3 core strategies: removing obstacles that get in the way of taking care of patients, driving the future of medicine by reimagining how we train and promote innovation, and then improving the health of the nation by trying to prevent chronic disease and confront healthcare crises and eliminate inequities. And I'd argue that combating firearm violence, tackling big issues like climate change fits squarely into that mission. These are issues that we deal with every day: treating victims of firearm violence, treating mental health challenges that ensue for survivors and family members. When it comes to climate change, it means treating increasing instances of respiratory and cardiovascular disease, injuries and premature deaths related to extreme weather events. I will tell you, if you just look at the impact of the Canadian wildfires this summer, the smoke that drifted down into the US, we saw, there's clear data on this, emergency department visits went up for asthma exacerbations 17% during this 19-day window. So there's a lot that very much brings into our mission. But I wanted to also talk about action. So we have formed a gun violence prevention task force. We also have adopted more than 30 policy recommendations to reduce firearm violence and trauma and injury and death. And I will tell you, the policies that we support, they're common sense. A majority of Americans support our policies. You ought to have a background check before you buy a firearm. We ought to have restrictions on the sale and ownership of semi-automatic firearms, bump stocks, high-capacity magazines. So I'm optimistic that we might get some movement on this front, because I tell you, every time I'm in the operating room taking care of a patient who's bleeding out because of a firearm injury, it just breaks my heart.
So the AMA also hasn't shied away from hot button issues like abortion and transgender care. These are very active issues here in Wisconsin. Why is that? And is there any concern that your stance on issues like these, as well as gun rights and climate change, is potentially turning away historic allies in Congress and other lawmakers that are needed for support on other big AMA issues like cuts to reimbursement and prior authorization and things like that?
Yeah, I'm not worried at all. We have bipartisan support in Congress, which is actually odd to see these days on a lot of our key objectives around workforce development, payment reform. And I will say that, the issues that you mentioned, our policies are pretty clear, and they come from the same grounding point, which is that we oppose the interference of government in the practice of medicine. We oppose any law that prohibits a physician from providing evidence-based medical care that is in the best interest of their patient. including government intrusion in the care of transgender people, as well as intrusion in reproductive health and other areas of healthcare. It's my view, it's the AMA's view that all decisions about healthcare should be made between a patient, their family, and their physician without a politician inserting themselves into the exam room. When you have a child who's sick, who has a respiratory illness, you might call a pediatric pulmonologist. When you have a child who has diabetes, you might call a pediatric endocrinologist. When you have a transgender child, it doesn't make sense to me that you ought to call a legislature. And so that's why we continue to fight aggressive discriminatory actions in states that seek to roll back patient protections, or in some cases criminalize the work of physicians in providing evidence-based care.
Overall, how do you think the political environment has changed in healthcare in recent years, and what impact do you think that is having on doctors and healthcare overall?
Well, I think it's a challenging political environment just everywhere in the country because we are a nation that is divided. But again, there's bipartisan support, I think, for this concept that we ought to do the things that keep people healthy. And so I'm optimistic that in spite of the challenges, and I'm sure I haven't checked my watch this hour to see if there's a speaker in the House in DC right now. In spite of those challenges, I'm optimistic that we'll be able to get movement on some of these key policy issues that are so critical to the AMA recovery plan.
Thank you, Dr. Ehrenfeld. We're quickly running out of time here, but I want to just take one final question to sum things up. What are you most, or kind of look forward, what are you most hopeful about when it comes to the future of physicians in Wisconsin and the U.S.?
Well, thanks for that. We've got a lot of challenges in healthcare today, despite our healthcare system being in crisis and so many of my colleagues being at their breaking point. I remain optimistic about the future. I remain optimistic about what lies ahead and where I know I can help lead America's physicians in the AMA. We can get this right. We can work to heal our nation, but it's only going to happen if we let physicians practice medicine that's driven by science and our understanding of the human body, health, and disease, by restoring trust in the healthcare system and allowing patients to decide what's in their best interest with their doctor.
Dr. Ehrenfeld, thank you so much for your time today. This has been a really great conversation. Thank you to Husch Blackwell and all our sponsors for making this possible. And thanks to all of you for tuning in. We'll be in Milwaukee for our next in-person event on November 14th, focused on improving infant and maternal health outcomes in the state. I hope to see you all there. Again, Dr. Ehrenfeld, thank you so much. Have a great rest of the day.